Shall we start, ma'am? Ma'am, your voice is not.
खुशबू स्लाइड्स
Yes,
ओपन
ma'am.
हो गई स्लाइड्स ओपन हो गई मेरी दिख रही है
No, ma'am. Slides not visible, ma'am.
जस्ट वेट फॉर खुशबू अभी हुई इज इट विजिबल नाउ
No, ma'am. Ma'am, I will start, then we will take afterwards, ma'am. Because it's on live, ma'am. So, good morning, everyone. Here we are great honor and please the welcome you all to our Institute 7th Alumini Speaks webinar. It is a glorious moment to extend my warm wishes on behalf of the Panna Subharti Nursing College. I want to convey my heartfelt gratitude to the Ms. Usha Yadav ma'am, Assistant Professor cum Simulation Training Officer in SGT University, for accepting the invitation and presiding over this webinar on simulation based education and pedagogy for transformative learning. So it's a great pleasure for me to introduce our speaker today. So Usha Yadav ma'am, also alumni of our college. So she had completed her undergraduation course from Army College of Nursing Jalandhar. After that, she had post graduated from our Panadhaima Subhati Nursing College. She was passed out on 2014. So it is a great pleasure for us. Then she had some more publications in national and international journals, and she was a simulation training officer. Then she simulation give training on based education and skill training for curricula on nursing and dental and medical sciences. Then design and deliver simulation based learning experience for graduate, working in collaboration with Indian Nursing Council also. Then organized and conducted so many webinars and so many training programs. So here I thank to Ms. Usha Yadav ma'am. So join us today. So now we are welcome to you, ma'am. Then now over to you, ma'am.
thank you Khushbu for a very humble introduction I'm glad to hear all these things and thank you to Subharti University, especially Panadaima Nursing College, to invite me for this webinar. And Subharti is always like my second home because whatever I am today, whatever experience I got from this university and college, it's all because of that only. Right? So yeah, so Khushbu, may I share my
Yes, ma'am.
PPTs?
Yes, ma'am. Yes, ma'am.
Sure. Okay. So is it visible, Khushbu?
No, ma'am. Ma'am, minimize this workout. Then afterwards, I think it will be visible.
Now is it?
Yes, ma'am.
Okay, now is it visible, right?
Yes, ma'am. Yes, ma'am.
Okay, thank you, thank you. So let me start then.
Yes, ma'am.
Okay, thank you, Khushbu. So good morning all. So today we are going to learn about a very special topic that is about simulation based education. And as you know, my topic is simulation based education and andragogy for transformative learning. So before starting this presentation, I would like to share the content outline that what I'm going to cover in today's session. So the content outline includes the three things which I'm going to discuss for this session today. The first is the pedagogy versus andragogy. What do you mean by pedagogy and what do you mean by andragogy? And the second aspect of my presentation would be simulation as an andragogy approach. Why we are saying that simulation is an andragogic approach. And then at the last, I'm going to share how the simulation based education leads to a transformative learning. So these are the three aspects which we are going to discuss and learn today. So whenever we are focusing on all these aspects, our main thing is which is coming in our mind is why I am sitting here and why we all are gathered on this platform to learn about this, right? So what is the need of pedagogy, andragogy, simulation, and transformative learning? So why we want to learn all these things and why we want to know about all these things? The reason is this: medical errors. So here I'm going to show some data to all of you that will enhance or that will focus on what are the magnitude and what is the magnitude of the medical errors nowadays in India as a world whole. So globally, if we say, according to the Joint Commission on Accreditation of Healthcare Organization and WHO, they say that medical error happens in 1 out of 10 patients every year. But if we talk specifically about India, then there's a beautiful study which is conducted by Professor Jha at Harvard. He says that 5.2 million medical errors happens annually. So why these errors are happening actually? If our education system is that much effective, efficient, then why these medical errors happen? So studies have been found that though after having lots of knowledge, lots of skill practice and all, still the practitioner are not competent and efficient enough to provide effective care to the patients, right? Why it is that? Why they are not efficient, especially in an such a condition which is critical or a condition which is unexpected, right? So in that manner, we have to focus on some changes. So what changes we want? What are the basic changes we want? We want a changes in our education system. We want to inculcate different approaches so that at the end of the educational or professional course, our healthcare professionals will be competent and confident. So now I'm going to show this picture. As you all are looking at this picture, so what you found in this picture? Yeah, so we found in this picture the different age groups, right? So we found a baby and then the toddler and then the adolescent and then the adults. So the person who's having this football is named as Mr. Rahul, right? So when we are looking at Mr. Rahul, he is having some time to apply whatever he is learning. Suppose he is learning in his school about maths, physics, chemistry, right? So he's not going to apply all these things immediately to solve their day-to-day life problems. But this person who is wearing this blue coat, the convocation coat, is the person who is going to interact with the real life scenarios, right? Yes. So this person has a responsibility on his shoulder that he has a responsibility to provide effective service to the community as a whole. So we want to focus on this person so that whatever services he or she is providing at the end or to the community, it will be effective and it will be having less error. So as we discussed about what are the different needs for children and for an adults, here I'm going to show some difference about how a child is learning and how an adult is learning. We used to call that children's are unwritten pages because they are not having any experience. So whatever we are telling them, they are eager to listen that and they are eager to learn that. And they are not counter questioning many times, right? But adults are written pages. They have lots of experience priorly. So we have to deal with all those things, right? The next is adding new information. So whenever we are teaching children's, we are always adding new information because they are blank, right? But adults, they are adjusting pages with better information. It means they are adjusting the new learning with the previous experiences. The children have few connections to build on because they have less prior experience, as I told you. And but the adults have several connections to build on, right? Because they have lots of experience in their life in different aspects. The children must absorb information. Whatever you are telling, they have to absorb. But adults, they are allowed to refuse information on the basis of their experience and the basis of their learnings. So it is very important. So these are the differences, right? The next is the children have low resistance for new information because whatever they are learning and whatever we are trying to make them learn, everything is new for them and they are very curious to learn the new things. But adults are high resistance for the new learning. Why they are having high resistance for the new learning? Why they are having high resistance for the new learning? Because they are having the previous experiences, right? Children are quick learners, yes, because they want to grasp everything very fast. Adults are slow learners. Are we slow learners? No, actually, we are not slow learners, but yes, because we are having some specific ideas and some specific experiences. So, because on those experiences only, on based of those experiences only, we are learning. So, that is why it will take some time for us to adjust the new learning with the previous one. So, we have to go and adjust along with that, right? So the next is, so that is why, as I discussed you that what are the characteristics of the children in terms of learning and what are the characteristics of the adults in terms of learning. So we should have the different approaches to deal with both. So children, whenever we are teaching or whenever we are make the children's learn, we are basically focusing on pedagogy, right? And nowadays also towards the adult learning, our education system is totally focusing on pedagogy. But here I want to share that no, we should not totally focus on the pedagogic approach of teaching adults, but yes, we should add some andragogic approach as well, so that once they are having some knowledge, some experience, they should critically think about those experiences and knowledges so that they can apply whatever they learned in the real life scenario. So that is very important. So the next topic, which is I'm going to discuss with you all, is about pedagogy and andragogy. As this picture is shown, pedagogy is basically an approach of teaching children's in which it is unidirectional. So whatever I'm teaching to the students or children's, they are grasping that, and there is no interconnection between me and the learners, and there is no counter questioning, right? Because they are not having, as I already told you, they are not having the prior information or prior knowledge or prior experiences, right? But in term of andragogy, there is a different approach. In andragogy, they are having the previous knowledge, experience, and learning. So whatever I am teaching them, they can counter question me. They try to understand that how the new learning is different from the previous one, right? So this is a difference between pedagogy and andragogy approach. So for going for the andragogic approach, we are thinking and we are assuming that the learners already have some basic knowledge and basic skill about that topic. So that is why we are saying that simulation-based education is an andragogy. So in the following slides, I'm going to discuss how the simulation is an andragogic approach. But first, let's explain or let's discuss what is andragogy. See these pictures, what this picture shows. Here's a person, here's an adult, and here's an instructor, or we can say the teacher or the faculty member. What the teacher says, the teacher make the person realize that where they are and what's their aim, where they need to be there, right? So what the teacher is asking from that student, the teacher is asking what need to happen to go from here to there. Here the teacher or the trainer or the instructor is act as a facilitator. He's not going to tell everything that what they need to do. The learner have to identify their needs and identify their strengths and weaknesses, and according to that only they are going to approach towards their goal. So here the teacher and the facilitator is actually a guiding light. They are not the instructors. They are not telling them steps, but they are just guide them so that at the end they are achieving their goals. Yes. So andragogy is basically an approach where we are teaching and where we are make the adults to learn effectively in their own term, by their own means. And why we are providing this andragogic approach towards adult learners? Because adult learners have specific characters. So let's see what are the specific characters we all are having, right? So the first is maturing self-concept. Maturing self-concept means when we are child, if I'm talking about the child, they are having less, they are having no self-concept. They are so much dependent on others. But as we are maturing, we are become self-motivated, or we are becoming self-developed, right? We are becoming mature enough to understand our needs and our goals, right? And we are not dependent on anyone. We are totally independent. So that is the one character of adults. The next is increasing experience. As I already told in the previous slides, that children are having less experience. So whatever you are telling, they are able to get the things. But children's or the adults, as compared to children's, the adults are having lots of experiences. And as the experience increase, the learning will be deeper and deeper. So they will see that aspect or that concept, whatever you are teaching, in a holistic way, right? The next is increasing readiness to learn. Here, the readiness to learn is nothing related to some subject matter or some specific aspect. Here, the readiness to learn is towards the solution of the real life problems. So they are going to learn, they want to learn those things which will help them to solve their current problems, right? So their orientation towards learning is the current situation, right? The next is shifting application and orientation. If we talk about children's, they're whatever, suppose a ninth grade children is there, they are learning the algebra, right? But there's no need and there's no urge to apply that algebra then and there, right? So they can apply that algebra in future. But in adults, whatever they are learning, there's a need or there's urge to apply then and there to solve the day-to-day life. So that is why there's a shifting in application and orientation. And at the end, the next characteristics of the adult learners is internal motivation to learn. Because children are motivated externally. They are motivated when they are thinking that if they studied, they have good marks and they score good and they'll score some positions in the class. But when we talk about the adult learners, the motivation is totally internal. The adults will learn when they find that, yes, if I learn these things, it will help in my self development, it will help in my career development, then only they will learn better, right? So these are the characteristics of adults. That is why we have to inculcate the andragogic approach in their teaching and learning process. So next is this picture. So whenever we are seeing this picture, so there are 4 components in this picture, right? We all heard about these things, that if I hear, I forget it. If I see, I remember it. If I do, I know it. And the 4th component is, if I discover it, I use it. So this 4th component is very, very important. That we have to find out that which way I'm comfortable to do which topic or which aspect or which skill, right? Suppose in simulation based education, there are different aspects, there are different components, which I'm going to tell you in further slides about pre-briefing, simulation, and debriefing. So about doing debriefing approach is different for everyone, right? So whenever we are providing or whenever we are performing debriefing among the students, we have to identify our approach of asking questions. And if I am founding my approach of asking question, I'll be comfortable and I'll definitely use it again and again. So the learning takes place to the adults once they discover the things. They identify how they are going to do that, right? So these are the 4, we can say, the components of an learning to the adults. So how we can make them to discover, right? How you can discover your strength, your weakness, and the way you are going to do things perfectly. The thing is by practicing again and again. Only by practicing again and again, we are going to discover it. For that, we have to move from traditional teaching to the modern teaching. What do you mean by traditional teaching here in this picture? So in this picture, it is shown that see one, do one, and teach one. Traditionally, when we got trained, how we got trained? How we got trained? That our teacher provided us some demonstration. Yes, that is C1. We provided the re-demonstration, that is do one. And then we are directly sent to the clinical area and we are performing the things, performing the skills on the patient. right? That is teach one. And we are learning the things on the real patient, which leads to more errors, which I talked about in the magnitude of the medical error, right? So now the andragogic approach told us that we have to move towards the modern approach. So what modern approach says? It says that we should see one, practice many, and do one. So here the simulation will be helpful because we are seeing one, our teacher is demonstrating some skills to us, and then they are giving us time to practice that skill even in the skill lab or in the simulation setting, so that we can practice those things many a times, and then we are performing those things on the real patient, so that we it saves two purposes, right? It saves two purposes. The first purpose is for the student, that again, by again and again doing practice, they are becoming the confident and competent persons and professionals. And when they are becoming confident and competent in that particular skill and in that particular aspect, they are comfortable to provide care to the patient, and the errors on the patient will be reduced. So that is why we have to move from traditional method of teaching to the modern method of teaching. I hope I am audible. Khushbu? Hello? Khushbu, am I audible?
Yes, ma'am, you are audible, ma'am.
Okay, okay, okay. Thank you. So I want to say to the participant whosoever joined with us in this session, please be interactive. So whatever doubts you are having during the scenario, during the presentation, do ask me, and whatever I am asking in between, do reply. Okay? Yes.
Yes, ma'am, they will.
Okay. Okay. Thank you, Khushbu. So let's move to the next thing. That is modern. I was talking about modern teaching methodology. So how to do this? How to inculcate this modern teaching methodology? For that, we have a very beautiful and effective framework which we called as circle of learning. This is a framework for healthcare education system or healthcare education program, in which we have the 5 components. These 5 components will make the student from scratch to the clinical area. As I told earlier in the previous slide, that how we got trained, we just got the knowledge and then demonstration, and then directly we are sending to the clinical area. Because of that, what happened, we are not that much confident. For many months we are just hesitant to deal with the situation or to deal with the patients. So by seeing all these things, this framework has been chosen for the healthcare education system, which inculcate these 2 components. First is decision making, and second is simulation in team. So let's start learning about this framework. The first component of this framework is knowledge acquisition. We all know the basic of our learning is a knowledge acquisition. We have to have some basic knowledge, then only we are going to improve ourselves, right? So after getting the knowledge, and knowledge acquisition could be provided to the participants and learner by various means, by PPT presentation, by showing them some video, by sending them to the library for making them assignments and all. After getting some basic knowledge and knowledge of that particular topic, they are moving towards the skill proficiency. Now they have to learn about whatever skill is included or attached to that knowledge aspect, right? Once the teacher is explaining, once the teacher is demonstrating the skill, they are now the students should have some time to practice that skill again and again, so that their psychomotor skills will be developed, right? And they will become competent in that particular skill. After that, there's the next component, that is decision making, because this is the lacking. Many researchers shows that students are having knowledge, they are having the skills, but when they encounter with the real life situation, they are not able to make the decisions. They are not able to make the decisions on the right patient on the right time, right? Because of that, they are not able to provide effective care to the patient, which leads to many medical errors. So that is why this component of decision making has been inculcated. So to teach decision making and critical thinking among students, we can conduct case studies, case presentations. We can go for the virtual simulations, in which virtually we are providing a patient and we are giving some situations, so that virtually they are, it's like a video game. Virtually they are going to deal with that situation, and then they are going to learn. And at the end of all these programs, they will get some feedback and logs through which they can know that yes, where I have to improve and where my decisions are wrong, right? And then after they learned about the decision making, we are moving them to the simulation. So simulation is basically a imitation of the real life situation. It is not real, but it is an imitation of the real life situation in which students feels like that yes, they are in the clinical area and they are behaving like that yes, they are dealing with a real patient. So the beauty of simulation in team is that they are having an advantage of doing errors, because this is the platform where they can do the mistake, they can do errors and they can learn from those errors, right? So this is a very important component in this circle of learning. And as you are able to see that it is written here that simulation in team, right? So as we are going to the clinical area and whenever we are going for the real life scenario, we are not going to deal with the patients or we are not going to deal with the situation alone. We are always working with the team. So here the simulation is a platform which provides the learner an opportunity to work in a team, so that along with the psychomotor skills and decision making, they're also learning about the non-technical skills like leadership skills, like communication skills. So these all skills will also be generated and learned through the learners, right? So that is why simulation in team has been inculcated in this. And after that, my student has to be sent to the clinical experience. So once they completed the knowledge, skill, decision making, and simulation, then only we are sending them to the clinical experience. So what you think, once you have the knowledge, you skill, decision making ability also, and you encounter many simulation scenario, and then if we are sending to the clinical area, how confident and competent you will feel? Definitely you will feel more efficient in your skills and in your performances, right? So this is a very beautiful framework which is known as circle of learning. So we have to inculcate this framework in our education. So let's talk about now specific about simulation based education. So as I told you in the circle of learning, simulation based education is basically an artificial representation of the real life scenario with sufficient fidelity, which is having minus the risks. Here the risk is not on the real patient, the risk is in the simulated area or simulated patient or simulated situation, right? So it is an artificial representation. We are not dealing or we are not conducting simulation in the real life scenario. We are not dealing with the real life patients or real patients. Here we are dealing with the artificial patients, or we can say the simulated patients in the form of standardized patient, in the form of mannequins, right? Like that, in the form of task trainers. Sufficient fidelity. What is fidelity? Fidelity is basically degree of realism. So as I told you, it is artificial representation of the real world scenario. So the fidelity would be not like it will not looks exactly like real world, but as much as real, right? So with sufficient fidelity, we are going to conduct the simulation. Minus the risk, I already explained, right? The next is structure of simulation, because this is very important to know or to understand what is the structure of simulation. So whenever we are conducting the simulation scenario, we are going through three phases along with the learner. So what are the three phases? The first phase is pre-briefing, the second phase is scenario, and third phase is debriefing. Pre-briefing and scenario are basically the experiential learning components in which the students or the learners have an experience of a particular scenario or a particular situation, right? And the debriefing is basically a reflective learning where they are reflecting back on their experiences in the pre-brief and scenario, and they are taking out the meaning from those experience, and because of that they are bringing or they are making new concepts in their mind, right? So these are the basic three components. So let's explain one by one. So first is pre-briefing. In pre-briefing, basically, we are providing instruction to the students in the form of ground rules. We are making them orient about the setting, what all equipments and what all facilities we are having, and we are making them handhold the articles. Here, we are also providing them the roles which they are going to perform during scenario, right? And along with that, with ground rules, orientation, and their roles, we are telling them the objective as well, that why we are going to conduct this scenario and what we want to achieve through this scenario, right? So these are the components which we are discussing with the learner so that they will feel comfortable we make sure that they are in a safe learning environment where they can perform whatever they know and whatever they can on the patient, right? So these are the pre-briefing. This is the first component of simulation process, where we are actually, as an instructor, instructing the participant that what is the scenario, what is the who is the patient, what are the articles available, and what are the objectives. Once the student are nicely briefed about all these things, they become ready for the simulation scenario, right? They are going to enter into the scenario phase. But before that, one more thing I would like to say here is that before starting the scenario, we have to tell that as an instructor or as a teacher, I will be standing in the scenario, or we can say the simulation room, or in the area where we are conducting the scenario, but we are not going to help you out. They have to manage the case by themselves. Then only they are going to use their knowledge, their learned knowledge, skill, as well as the decision making abilities, right? So we are not going to interfere during the scenario. Let them do whatever they know, right? And then after, I think, as a teacher, if I think that yes, my student achieved the objective, I will stop the scenario, and then the later part will be doing. So this is all about the pre-briefing. I hope you understand, right? The next is one video which I'm going to show you about. This is about simulation scenario, how it looks like. So this is a video of simulation scenario where the patient is having cardiac arrest. So just look how it feels like and how students are engaging or immersing themselves in the scenario. What happens? Patients not respond. So I hope the voice is audible, Khushbu.
Yes, ma'am, it is audible.
Okay. So yes, just now as I show you the scenario, so just like that, we are conducting a scenario, we are preparing the environment, and then we are sending the students to the simulation scenario, so they can think they can think about the situation, they can take the decision, and they perform the skills and whatever knowledge they acquire, right? So after that, the next component would be the debriefing. In debriefing, we are actually sitting with the students. So if I say debriefing is basically the heart and soul of the simulation process. Here we are discussing with the students whatever experience they are having during scenario, and what all things they did actually. And we are making them reflect that what are the good points or what are the lacunas they faced during scenario. And we are asking from them that why they felt those lacunas are there. That is a basic reflective learning. We have to make them understand that if they are doing some mistake or some error during scenario, why that happened. Let them think that what's the reason behind that mistake or behind that good point, right? Once they understand, okay, this is the reason, maybe they are not able to perform the things because they are not well versed with the knowledge, or maybe they are not well versed about they are not practiced many times that particular skill. So they identify, okay, there's a lack of practice, so I have to focus on the practice, right? Once they got to know the lacunas or the problem because of which the errors happen during scenario, we are asking from them that, okay, what are the solutions for those problems. So here, as a teacher, I'm not going to tell them that they perform any component wrong in the scenario and how they are going to improve the problems, the cause of the problems, and the solution of the problem. Everything will be coming from the learner itself. Because of that only the learning will take place. Because of that only the frame of mind of the learners will take place. Because, and as an adult, if I'm telling some adult that, okay, you did this wrong, right, how they will feel? They will feel defended, right? They are not agree with me. But once I make them realize by themselves that yes, this is the mistake which is done by them, they definitely remember that experience.
Hello, ma'am. Ma'am, it's not audible. Dear participants, please wait 2 minutes. I think it's some network issue. So please wait 2 minutes. Dear participants, please wait 2 minutes. There is some network issue from madam's side. So we will connect as soon as possible.
नहीं आ जाऊंगी अरे हेलो हेलो खुशबू हेलो
Hello.
मैं ऑडिबल खुशबू
Yes, ma'am. Now you are audible.
Sorry for the technical glitch. My laptop got hanged. Let's start again. We are on debriefing slide.
Yes, ma'am. Ma'am, your slide. Yes, ma'am. Yes, ma'am.
Okay, okay. Now it's visible, Khushbu,
Yes, ma'am. It's visible, ma'am.
and I'm also visible, right?
Yes, ma'am.
Yeah, so let's start. So it's like a break in between.
Okay.
So yeah, so as I was talking about debriefing, and I was talking about from where we got disconnected, Khushbu. At what point we got disconnected? Hello.
I'm debriefing.
Okay, okay, okay. So I'm starting from debriefing inwards, onwards. Okay, okay. Thank you. So this is the third component of the simulation-based education, that is debriefing. Here we are actually sitting with the student to make them reflect about whatever experience they are having during scenario, right? And this is the heart and soul of the simulation process. So here, whatever students are having the experience, we are discussing on those experience only. So here, the technique is like we are asking them that how they felt, what happened actually during scenario, what are the good points and what are the lacuna they faced and what are the barriers they faced during performing the scenario, and then we are asking what is the reason behind that. So everything will be contributed or everything will be discussed with the students. They only telling us the problem, they are only telling us the cause of that problem. Once they know the cause of the problem, then the next question which we are asking in the debrief from the student, that how they are going to improve. So the solution of the problems and the solution of the lacunas which they faced during debrief is also discussed by them. So this is the beauty of the debriefing, that self-reflection will be there, because this is very, very important whenever we are dealing with the adults education. Until and unless a adult understand by themselves that yes, this is their mistake and like that they have to improve on, then only the learning will take place, right? Suppose I'm conducting a scenario, suppose this is the cardiac arrest scenario which we have seen in the previous slide, right? So the students who is performing the ventilation part, they are not providing they are not using the ENC technique while attaching the bag and mask, right? So when I'm sitting with them during debriefing, I'll ask from them, okay, so how you have provided the ventilation, are you getting the chest rise? Because during scenario I observed that I'm not I observed that the patient's chest is not rising whenever you are providing ventilation. So they themselves realize, yes, the chest of the patient is not rising. Then I can ask from them, okay, what's the reason behind that? And I can ask directly, so how you provided the bag and mask, how you place the mask on the patient's mouth, right? So like that we can take out the problems and we can take out the points, and from there we can ask them, okay, next time if you are going to provide the ventilation to a patient who is having cardiac arrest, how we are going to do that? So the solution also will be provided by the learners itself. So this is the way we are asking, and this is the way we are debriefing the students. So when we are debriefing, there are various approaches we can use, right? So what are the various approaches we can use when we are doing debriefing? So we can do the first is a facilitator only debriefing, where one teacher is there who is conducting the scenario throughout, and from there they are discussing with the learners after conducting the scenario. So this is the picture which is showing one facilitator is there who is conducting post scenario discussion, or we can say debriefing among the students. After that, this is the next kind of debriefing where there are two facilitators. So where one facilitator and the second facilitator, so they both connecting each other with, they both connecting with each other, and they both in a collaborative way they are discussing the things with the participants. So here we can have the co-facilitator along with us as a content expert as well. And the next approach is video assisted debriefing, where we are going to show the whole scenario video to the students and make them reflect and make them show that actually this happened, and make them reflect by themselves that why they perform this aspect and how they are going to improve on those, right? So this is the beauty of the debriefing, where the students are going to learn the basic learnings in simulation based education is actually taken place in debriefing phase only, where their frame of mind will change. Khushbu, excuse me, Khushbu,
Yes, ma'am.
am I? Are you able to see the slides?
No, ma'am. Only first slide is showing, ma'am.
Okay, first slide then. Okay, okay. Let me connect again. Let
Yeah,
me.
I'm also trying, ma'am, but it's not correct.
Aman ma'am, just give me 1 second, Khushbu.
Yes, ma'am.
Actually, I was thinking that you are able to see, but one of my colleague told me
No,
that it is
I'm
only in the
also
first slide.
trying to see that. I think my network issue. Yes, ma'am. It's visible, ma'am.
Now it's visible. Okay, thank you,
Yes,
thank
ma'am.
you. So I was showing these pictures actually in the previous slide. The one facilitator based debriefing, two facilitator based debriefing, and video assisted debriefing. Is it visible now?
Yes, ma'am. It's visible
Okay,
now,
okay,
ma'am.
okay, fine, fine. So let's see the next component, which is very, very important, that how simulation based education is andragogy. How we can say that simulation is an andragogy, because the andragogy approach has some outcomes which are similar to the outcomes which we have got through simulation based education. So what are the outcomes? The first is understanding of oneself. Whenever we encounter in the simulation based scenarios, we understand our motivation, we understand our needs, we understand our challenges, right? And once we understand those, we can work on those. And because we are working on those, then the transformative learning will take place. Then our approach of dealing with the things next time will change. The next is acceptance and respect towards others. Because whenever we are conducting simulation based education, we are conducting in a team, right? We are working with a team. So, as I told you earlier, also, that whenever we are conducting simulation based education, we are not teaching the technical skills only, we are also teaching the non technical skill as well, about the communication technique, about the leadership, about the many non-technical skills we are dealing with whenever we are conducting simulation based education. And because of those skills only, we accept the viewpoints of others, we respect the others viewpoint as well, and we try to listen them, okay, what they want to say about this aspect, right? The next is understanding and reacting on causes, not symptoms. Because whenever we are conducting simulation, especially during debriefing, we are going in depth. We are going in depth in sense that we are going in depth the root cause of their actions, that what is the frame of mind with which they are performing that particular action? What is the frame of mind with which my student is providing the ventilation? Why she's not providing with the by using ENC technique on the patient? Next is understanding human experiences. Because when we are conducting simulation scenario, when we are running the scenarios, everyone has some experience in their life. So they are working according to their experience. And when we are seated with them during debrief, they are also sharing their experience. They are discussing the things in their way, in their perspective, right? So these are the changes, or these are the outcomes which make simulation based education an andragogy. Because andragogy approach assume that students should have a basic knowledge, prior basic knowledge, then only they can challenge They can see how and why I'm doing so, and what are the needs I have to change on in the future. So these are the things we have to focus on. The next aspect of my presentation is the transformative learning. As you are able to see this picture, so this picture itself shows that a person is transforming himself from a big fat body to a slim one, right? And who is doing this transformation? Only by the person. So the transformative learning is always takes place by self. Okay, as a teacher, as an instructor, as a trainer, we can only guide them, but the transformative learning is only happens once the things fitted in their mind, once their frame of mind changes, and then they are ready to change, and then they are ready to apply the new things in their life. So let's see how transformative learning takes place by using simulation based education. For that, I'm going to share you COP cycle of experiential learning. This is a very effective model which is given by the COPs in the form of cycle. So this cycle has four component, and it is a kind of cycle which is continuous throughout our life, right? So the first component of this cycle says concrete experience. So whenever we are teaching the adults, we should move from the chalk and talk method, right? We should provide some hands-on experience to them, because when they are experiencing which have emotions with them, then that learning will be for a longer period of time for them, right? So first we have to provide some experience in the form of hands-on experience which involve the emotion as well. And whenever we are conducting simulation based education, we are inculcating the emotions along with the hands-on practice, or we can say hands-on activities, right? Once they got the experience during the scenario, after completing the scenario, the next component is reflective observation. We are sitting with them in the debriefing session, we are making them reflect on their own actions during scenarios. As I already discussed in debriefing, we are making them reflect on their good actions as well as on their lacunas, and on all those aspects in which they should move on, or in which they should improve, right? After that, we are having the next component, that is abstract conceptualization. When the student and when the learner reflect back on their actions, and then they realize that that is a problem, and that is the consequences that will lead to because of that problem, and how I'm going to improve, then the new frame of mind will change, right? Once, if I'll take the same example which I show in the video, if my student know that yes, she's not getting the chest rise, if she's not getting the chest rise, it means the proper ventilation is not going right. And if we are not able to provide proper ventilation, what it leads to, right? We are not providing oxygen to the blood supply, and we are not providing oxygen especially to the brain along with the chest compression, right? And if we are not able to provide that, what it leads to further, we may lose the patient. Once they know the consequences, the concept will arise in their mind. The new frame of mind will generate, and they will apply that concept very vividly, and they will definitely do not repeat that mistake in the life, right? So that is why the next component, that is called as abstract conceptualization, because now they are adding new things along with their previous experiences, right? Once they have the abstract conceptualization, or we can say they have the new concept or the new learning, then next is active experimentation. After having all these things, now whatever they are learned, they are going to apply those learned aspect in the new situation next time, and then they will have another experience, and from that experience they again have to reflect back on, and then again they are getting the new learning, and then again once they are getting the new learning or the new concept or the new aspect they learn, they are going to apply under new situations, right? So this is how this cycle will always continues in our lifetime. So after each experience we are learning new things, and on the basis of those learning only we are moving forward in our life, right? So this is a very beautiful model which is given by the corps, which explain how transformative learning takes place by conducting the simulation based education. The next is, what are the elements which we can inculcate whenever we are performing simulation based education, whenever we are dealing with simulation based education, so that transformative learning takes place among the learner. So there are few components which we have to focus on. The first is safe learning environment. Here we are providing the students a scenario, a situation where we are telling them that you have to manage this case by yourself. So how my student will feel? They will definitely feel hesitant, they will definitely feel anxious. So to make them comfortable, to make them relaxed, so that they can perform, they can use their mind, they can use their critical thinking while they are immersed in the scenario. We have to provide a safe learning environment. So the question is how we can provide the safe learning environment. So there are various approaches from which we can use to provide safe learning environment. The first is we have to tell them that this is a learning platform. So whatever you know, you have to perform. Nobody is going to judge their actions and reactions because this is a learning platform, right? And the whatever we are conducting during simulation scenario, there should be confidentiality. As a teacher, I should not discuss whatever my student did in the scenario along with my colleagues or outside the room, and I expect the same from the learner as well, that they are not going to discuss these actions and reactions of any one person outside this room. So confidentiality is also very, very important. Once I told them this is a learning platform and you are open to do whatever you want to do, then they feel relaxed. And moreover, when I'm doing pre-briefing, which I told you earlier, when I'm doing pre-briefing, I explained them about the environment, about the equipment, about the patient. By making them orient about the setting and all, about the objectives, they will feel definitely relaxed, right? And it will be very, very open. So whatever doubt they are having during debrief, they can ask, they can discuss from each other. So like that, we can inculcate the safe learning environment. And if we are providing safe learning environment, adults will be more open to learn, because there's a hitch, there's a hesitant in the adult learners, that if I do something, what other people will think. So we have to reduce, we have to minimize that aspect, that then only they will learn better, right? The next is individual experiences, because here everyone has some experience and everybody got experience after the simulation scenario. So we have to respect those experiences, right? We have to make them involve and discuss their experiences. That is also very, very important element whenever we are fostering transformative learning among the learners. Then critical reflection. Critical reflection is very, very important. Here we are critically analyzing the situation. We are going in depth. We are not seeing the things superficially. We are going in depth, that if something happened during scenario, we are not only seeing the actions, or we are not only seeing the output, we are seeing the frame of mind, we are seeing the thought process because of which my student is doing. Suppose if I am giving an example here, suppose I'm conducting a scenario on NBR, neonatal resuscitation. The baby born and the baby is not crying and breathing. Immediately they are clamping the cord, cutting the cord, and taking the baby to the radiant former, and they are not announcing the birth time, right? So when I'm sitting with a student in the debrief session, I should ask them what is the time of the birth. Then they realize, okay, I didn't mention the time of the birth. Then the next question is, what made you to not mention the time of the birth? Then they have to reflect back on their frame of mind and their thought process and whatever is going on in their mind. That maybe, ma'am, I was anxious, I was so much curious to save the baby. I was so much worried about the baby's condition, that is why I just forgot. Then I should ask then, okay, if you forgot to mention the time, what it leads to? Definitely in NBR, the golden minute is the vital thing. So we have to make them realize. And this happens only by doing the critical reflection among them, right? The next is dialogue between participants, because in simulation based education, it is always two-way. We are asking open-ended question and they have to reflect on their experience, they have to tell those things, right? So it is always a two-way process. We have to dialogue, we have to discuss with them, we have to let them come up with their perception and with their concepts. And then the role of fiction, whenever we are conducting a simulation based education, we are going to establish a fiction contract. What is fiction contract? Fiction contract is basically a contract which we are establishing with the learners, that though this is a simulation situation, but whatever you are doing, your actions are real, right? So this is very, very important, because whenever we are establishing this fiction contract, there is a kind of responsibility will be generated in their mind, and they are performing the things very professionally and very responsibly during scenario. They will not take the things lightly. Feedback. So whenever we are conducting simulation based education and when we are seated in the debrief session, we should provide constructive feedback. Once we are doing reflection, and at the end if I found that okay, I should give some basic information here to the students so that next time they will not repeat the same mistake, I'll become an instructor and I'll add some constructive feedback to them, right? And at the end, practice. Once they have one scenario, once they have one experience of the scenario, then we have to let them go again and again for the resimulation so that at the end they will be perfect in that particular aspect. So these are the basic elements which foster transformative learning in simulation, which will change their mindset, right? So these are the things. So if I'm talking about transformative learning in simulation based education, how it takes place, because in simulation based education we are actually focused on the frame of mind, not only on the actions and results. Because in basic other form of learning we are focusing, okay, my student is doing that, because of their action this happens. She is not providing ENC technique properly, that is why just rise is not there. But we are not focusing on the frame of mind, what is happening in their mind during that point of time, whether she is anxious or whether she don't know the technique, right? We have to know the reason. So transformative learning takes place once we touch the frame of mind, once we tweak the frame of mind, once we change the frame of mind, right? So that is why in simulation based education we are not only focused on the actions and result, but we are primarily focused on the frame of mind, the reason behind their action. That is very, very important. So here I'm showing some researches also. So about transformative learning. So this is the research which is conducted in 2020, and it is exploring transformative learning when developing medical students and non-technical skills. And yes, for inculcating the non-technical skills, simulation-based education is very effective mean for transformative learning among the medical students. The next study, which is conducted in 2010, it is basically transformative learning as a context for human patient simulator. In this study, they are having the mannequins on which they are conducting the scenario, and at the end, they found that yes, the frame of mind of the students has been changed whenever they are conducting the simulation session by using human patient simulator. There's a very beautiful study which is conducted in 2021 August, which is recently they have conducted this narrative inquiry study to understand undergraduate nursing student transformative learning through disorienting dilemmas associated with end of life care situation. Here disoriented dilemmas are basically their prior perceptions or their assumptions about the care which is associated with the end of life, right? So here the researchers conducted a simulation where the aspect or the theme of the simulation is end care, life care, where they are enrolling the students, and then they know many things which they are thinking earlier that like that they are going to provide care to a patient who is about to die, right? So because of these kind of simulation only, they are, if we are making the learners to disorient their dilemmas or their previous assumptions or perceptions and make the new concept which will help them in their future actions. So this is how they are doing in this simulation session. So as I discussed all of these studies, so and all these process, what is andragogy, what is simulation based education, and what is transformative learning. There's a very beautiful study which also says that high quality simulation can substitute up to 50% of traditional clinical hours across the pre-licensed nursing curriculum. Based on this study is basically done by NCSBN, very beautiful study in USA. And based on this study, established uh, Indian Nursing Council want to inculcate simulation-based education nursing component in nursing curriculum, because of which he established Indian Nursing Council collaborate with HDT University, with Ladle, with Chipago in a collaborative manner, so that they can establish a national reference simulation center where they can train students, not only students but first the faculty members, right? So once this faculty member got trained, then only the student get trained. So because with that aim, Indian Nursing Council has established a national reference simulation center. So this is a need of our, that simulation based education should be used as andragogy approach for the transformative learning which leads to the change in perspective of the learners. So this is the need of the hour, and to manage or to deal with this need, Indian Nursing Council has established this National Reference Simulation Center, in which I am a trainer. I am working here, and in this I'm going to show one short clip of our center. Welcome to India's first National Reference Simulation Center, NRS, located at SGT University in Gurugram. The 13,000 square feet simulation center is developed in partnership with USAID, Chapaico, Lardle, SGT University, and Indian Nursing Council to implement nursing and interprofessional education in a state of the art simulation center through integration of skills and simulation into nursing curriculum. The first step will be to train master trainers from nursing colleges from all states of India. The center is designed to cover the entire curriculum of BSc Nursing using the experiential learning methodology illustrated by the Circle of Learning. The first element is knowledge acquisition, for which the center has a designated area. The second element is skills proficiency. This large space of over 1,000 square feet is designed for training and practicing in individual skills using task trainers and mannequins like intubation and IV. There is also an allocated space to practice quality CPR. It can also be set up as a classroom area. There is a dedicated room to learn and practice critical thinking, clinical reasoning, and decision making, essential for quality care. Now let's move to the heart of the center, the simulation rooms. Every room replicates an actual clinical setting. The environment and the high quality simulators make the experience realistic, resulting in highly effective learning. Every simulation room has its own control room with a one-way viewing glass. Facilitators can operate the simulators and observe a session from the control room without disturbing the participants. Debriefing is the most important part of simulation, and every room has a separate area equipped with audio-visual aids. All the simulation rooms are soundproof and are designed to provide a safe learning environment for the participants. We hope you enjoyed the tour of the National Reference Simulation Center. We welcome you to visit. So I hope you have gone through this beautiful video of our center, and you have some idea that how we are working here, how we are making adults to transform them through this transformative learning as an andragogic approach, and why we are doing all these things. The aim is ultimate, that is patient safety. Because of all these things, because conducting this simulation based education trainings and everything, we want our nursing professional to be competent and confident enough so that they can perform the things provided very effectively on the patient, so that the patient safety will be maintained and our professional growth will be enhanced, right? So with this lines and with one quote, I would like to conclude my session. And the quote is like, transformation is often more about unlearning than learning. If you want to transform yourself, you have to unlearn the previous experience which you had, and then only you will move forward. Thank you so much for giving me this opportunity to share my aspects on simulation based education. Thank you, Vishnu.
Thank you so much, ma'am. A very great session and very informative. We know very new things regarding simulations. So I'm here asking to participants, if you have any doubts, then you can ask to madam. If you have any doubts, then you can write in chat box. I think they clear all the things, ma'am. They don't have any
I hope
doubts.
so.
Okay, no problem. If you have any doubts, you can ask to me later afterwards. Then I will ask to madam. She will give you answer. No issue.
Definitely, definitely, anytime. Yes.
Then thank you so much, ma'am. Now I'm invite to Mr. Saral. He is also member of our alumni association. Mr. Saral, assistant lecturer from Panna Subharti Nursing College. He will give a vote of thanks to ma'am. Sir.
Thank you, Madam Khushbu. Jai Hind to all and Jai Hind to Madam. Actually, myself, Saral Kumar, I am also the member of this alumni committee from Panna Dharma Subharti Nursing College, Madam. And first of all, I would like to thank our guest speaker, Madam Usha Yadav. You have given a very good lecture, a very informative lecture to our alumni, to our participants. I hope that it will be really helpful in the future. Thank you so much, ma'am. Next, I would like to thank our principal and head, ex-captain Professor Dr. Geeta Pravanda, madam. And under her guidance only, we are able to make or we are able to organize these kind of, the webinars. It will be really helpful for our alumni, for our participants, wherever they are working in the world or all around the world. And next, I would like to thank our participants, our alumni, those who are connected with us. It is really, really very helpful for them. And personally, I want to share my thought that as an alumni, as a member of our university or our institution, you always please connected with us. Please be in touch with us, because you can share your ideas, your experiences, your exposure wherever you are working. It will be really helpful for you. And at last, I would like to thank all those who are present here, those who are connected with us. But please, it is my humble request to you all, or you also, madam, that in future also be connected or be in touch with us, because if we are organizing these kind of events now, ma'am, that only we are connected with each other. Because as per my perception, we always behind our institution, we always should behind our institution, we always should follow our institution, because people will change but the institution will never change, and the institution will always ready to help you wherever you are working, wherever you are having exposure in your profession. It will be strengthen our profession also. At last, again, I would like to thank to all of you for those who are present here. Thank you so much, ma'am.
Thank you. Thank you. And I also want to thank our principal, ma'am, Geeta Parvanda, ma'am, because of her guidance and her, whatever I can, I have no words for her, that how she made me like this. And it's all ma'am's effort and all ma'am's guidance that I'm here. And I would like to say thanks to the whole fraternity of Panadhaima Nursing College. Uh, I hope that my session is fruitful and it's meaningful for the learners. And thank you so much once again. Yes.
Thank you so much, ma'am. So thank you very, very much, ma'am. It is a very grateful, great session, very knowledgeable session. Then we will arrange next month also. Then please, ma'am, you also connect with us. Every month
Definitely,
we will
definitely.
organize, ma'am, this webinar series, ma'am. Every month, then we will connect with the next month also.
Thank you. Thank you.
Thank you so much, ma'am.
इन्होंने तो बहुत लंबा खींचा